Hello, my name is Wyc Cheatham. I am a pediatric intensivist and neonatologist here at EIRMC, board certified in both, and help take care of little babies all the way up to young adults. One of the things we want to talk about this winter season is RSV. RSV is a virus that causes significant infection in all age groups, including adults, but seems to cause the most serious infection in babies. RSV stands for respiratory syncytial virus. It's a fancy name for a little bug that causes significant infection in babies and children, as I said. It's something that's passed around all year long, but we see it more in the winter as we all come together and kind of mix and mingle. It allows the virus to transmit among adults and kids and little babies especially. I think that by far studies have shown hand hygiene, simple soap and water, and doing your best to not transmit the disease through coughing or sneezing or other contacts that might expose the next person that comes near you or next to you. The other way of preventing it is a vaccine. However, this vaccine is not yet approved in all children or adults or pediatric populations. It's limited for use only in those children that are at high risk. Usually it starts out as a typical cold. It starts out with some nasal congestion. From there it can spread to get a cough. It can be either low-grade, mild type of cough or a productive cough as the symptoms progress. Also fever. Any fever greater than 100.4 in a small child, especially the first month of life, should be treated and recognized and brought to the doctor's attention. The other three that you might look for in a baby are poor feeding. Baby really can't feed because they're putting all their energy into breathing. The other thing you might look for is some wheezing. You can actually hear your baby's lung sounds when they're moving air. Lastly, they might have pauses, or what we call apnea spells or apnea, where they're not breathing for those periods of time. As treatment for this is really limited to supportive therapy. The studies have come out conclusively that over-the-counter medications do not make a difference in RSV in children younger than 6 years of age. The only medications that really seem to have a place in this is Tylenol and ibuprofen. Those are the really only medications we'd recommend using, and certainly nasal sprays and combination oral drugs and decongestants exist for the older population, such as those 6 years or older, but should never be used in children under 2. One thing I like to emphasize to parents is to stay away from cough suppressants. The only time a cough should really be treated is probably under the direction of a doctor and a small child under 6 months or 2 years in that age range. And after that, as the child gets older, around 6 years of age, we feel that the RSV is very well handled with the combination of over-the-counter nasal decongestants, antipyretics, the Tylenol and the Motrin, and maybe single-agent cold remedies. When those symptoms that I described earlier become so severe that the child can't feed very well, is having problems breathing, or they might have a pale or bluish discoloration to their extremities. These are signs of cyanosis or poor oxygen, that the baby's lungs are not working anymore. Anytime the baby has these respiratory pauses, they should be taken in. Very few babies with RSV are hospitalized. Roughly 1 in 100 are hospitalized. Here at EIRMC, we have both the general pediatric floor that can handle most of these babies, but we also have board-certified pediatric intensivists available 24/7 and a staff of nurses that are fully capable and trained to handle these kind of situations. Hopefully it's just for a short period of time they might be admitted, but EIRMC usually does have all the services and certainly has the resources to meet these children's needs. The duration of the illness usually runs from 7 to 12 days. Symptoms usually peak around day 2 to 5. So if you can get past those days, most likely you're going to be able to manage this child as an outpatient. However, on day 7, day 8, or later in the course, if the child were to become more ill, you do need to be a little more cautious there, worrying that maybe a bacteria has now joined the party and we do have a pneumonia. So just be cautious of a child that seemed to get better and then suddenly seems to get worse. So in summary, I'd just like to say that RSV is probably the most common infection in young children. Certainly the leading cause for hospitalization in young children. But with preventative measures, which is I think should be the mainstay of this entire talk, hand washing, good hygiene, and good supportive care, working in conjunction with your pediatrician, most hospitalizations can be prevented and most children do quite well.